Welcome. It is Friday, May 1st. We are hosting our Friday knee replacement Q&A. So what does that mean? It means that Dr. Sinha, my husband Raj, and I, Diana Braun, are here. We are the ones who wrote Knee Replacement Secrets, and we do our best to go live on most Fridays for you to be able to ask questions you have about knee replacement, whether you're preparing, avoiding, or maybe you're in the middle of it right now. Maybe you are trying to recover and you cannot sleep. You cannot get comfortable. You are swelling. You thought, I had this 2 weeks ago. I thought I'd be like running a marathon by now. What's going wrong? So we're here to answer all of your questions. I had bilateral knee replacement myself 2.5 years ago. So I try to post a video every single day on Instagram and Facebook to help educate you on what you can expect, give you tips and tricks, and that's really why we show up here every week. DMAC 326, February 10th, bilateral knee replacement. Okay, you're a few months out. Is there a difference between max knee flexion on new parts versus original? Yep. So how much flex did you have going in originally?
It's a multi-layered question.
Yeah, it is.
The first aspect is the general rule of thumb that your pre-operative flexion is what you can expect post-operatively. Now, that is based on older data, and I've actually written a paper showing that I get increased flexion by 15 degrees. So there's some newer techniques that allow you to get better flexion. But that's a general rule of thumb. I think it still has some biological, anatomic, and physiological basis. A normal knee, non-arthritic knee, will bend to about 155 degrees. That's basically your buttock touching your heel when you squat, or your knee on your knee. That's 155 degrees. To get 155 degrees in a normal knee, the tibia bone actually rides off of the femur bone completely. Amazingly enough, they're not in contact. You don't want that with your artificial knee because it's a mechanical part and it's not designed to have that same sort of resiliency and anisotropy, that's a technical term, that your normal body has. And so as a result of that, most of the artificial devices are designed to accommodate about 130 degrees of flexion. And you've got about 150 degrees of flexion in your knees.
And going into it, I had a ridiculous,
You had 155.
Yeah.
Going into it. Yeah.
I mean, I could do more. I mean, I used to be able to pick up my foot and bank it into my rear end very easily. I don't have that much anymore.
But when you kneel, you can get your buttock
kneel
down to your heel. So that's about 150 degrees.
Yeah. I've worked very hard on that for 18 months. So
I think the point that I'm trying to make there is that the device probably is not really designed for that.
Yeah.
And like when I told her surgeon she had that, he was like, but listen, physiology is physiology, and the plastics are really good these days, and so I'm not too concerned about that. So
and I'm not pushing mine further.
Yeah, and I would say get what you can get.
Yeah. But you can kneel, and so I don't know what you're trying to accomplish, DMAC 326, but bilateral takes a long time to recover, so be patient. Hopefully you're doing well.
And it is definitely not a linear recovery.
No, you will definitely have a few setbacks along the way. I'll just give you a little sneak preview of that.
But they're 3 months out now already, almost. So good.
You're past the worst of it. All right, everybody, have a great weekend. We're glad you came.
Have a great weekend, everybody.
All right, bye.